Everybody, I'm gonna give us some time to get everybody on the line. It's gonna be a full house today. Could somebody make sure that they can see my screen that I'm sharing, the PowerPoint? Anybody could talk.
You can see it, Jen.
Thank you. So I'm going to ask that people email me that they have attended, because I can see some of you who call in, but others it identifies you just as caller 1, caller 2, etc. For instance, caller 5 just joined. So if you could email me that you have attended the meeting, that way I know you've gotten the training that you need. And then secondly, this slide is about how to mute your phone, because I'm already hearing feedback. So I need people to mute their phones in your presentation. So this slide on the left talks about how to mute your phone. And it does not light up. It will flash when you hit the button that it's muted, but it doesn't necessarily tell you that it's muted. If you're on the video program, it is the microphone looking icon, the screen that I showed you has to be red, and it will tell you that you're muted. I can see who's muted and who's not. Okay, it's 2 after 1, so I am going to get started with the presentation. Get some feedback, so I hope you guys aren't hearing too much. There is a chat in the presentation, so if you have questions that come up as I'm speaking, you can use that. But I will pause after some slides to give you an opportunity to speak and ask questions at that point. So we are here to talk about the Family First Coronavirus Response Act, what that entails. I have had a training with the timekeepers last week, and I have had a training with some supervisors this morning. I have also sent out a citywide email that talked about the 2 main purposes of this leave that are being provided by this federal. So the 2 main components are the emergency paid sick leave and expanded family medical leave. So this emergency paid sick leave is in addition to what is provided by our own sick leave as an employer. As a result, we spent most of the weekend working on creating a new sick leave accrual bank that will appear on hourly employees' paychecks as of this Friday. To effect as of April 1st, Wednesday of last week. So Wednesday of last week going forward until the end of the year, it is in effect. If we have employees who are missing work because of one of the valid reasons, which we'll go through, they would have access to the family medical leave. Is a paid leave. So many of you are familiar with family medical leave, or FMLA, and that it provides 12 weeks of unpaid leave for a serious health condition. This is an expansion of that, but it has some significant differences, which we're going to go over. First, we're going to turn to that EPSL, which is emergency paid sick leave. Right now, our sick leave account is for full and permanent part-time employees. This sick leave expands that to temporary employees, permanent part-time employees, and full-time employees. It does not matter if you are union affiliated, in a dues paying capacity, in a covered position capacity, or if you are non-contractual. If you are hourly, you would have access to this paid sick leave. The only exceptions in the law are independent contractors, volunteers, or unpaid interns. Other question that I had coming up on eligibility is our furloughed employees. We have a group of furloughed temporary employees that were furloughed on 3/28, 3/29, around there. They would have had to have been in active status, not furloughed status, as in order to have access to the sick leave. Looking forward, because the sick leave is in effect until the end of this year, 2020, December 31st, any furloughed employees we bring back or any temps that we bring on will have access to this emergency paid sick leave at that time. They do not have access to it now if they are furloughed. The 6 reasons you can use emergency paid sick leave are as follows. Number 1, the employee is subject to a federal, state, or local quarantine or isolation order related to COVID-19. Now, that law has been expanded to say, under the guidance, that a shelter-in-place qualifies as a quarantine, a stay-at-home order or a stay-at-home advisory qualifies as a quarantine. You may know that Governor Sununu, in his emergency order, exempted municipalities or local governments from the stay-at-home order. Therefore, we are not eligible to utilize reason number 1, the expanded, the emergency paid sick leave. The only exception to that is if we, as employer, the supervisor, quarantines an employee because of exposure, then we're acting as the local government to quarantine them. And we have done that in cases where we want to protect the workforce because of a suspected secondhand exposure, whether it be through a spouse or some other contact. So number 1 applies when we, the employer, are quarantining an employee. Number 2, the employee is quarantining as a result of an order from a healthcare provider because of an actual diagnosis or because the healthcare provider has concerns related to COVID-19. So that could be your employees who may have diabetes, have heart conditions, immunosuppression conditions. Those individuals with a doctor's order, so a doctor, healthcare provider order, they can access this sick leave in order to quarantine at home. Number 3, the employee needs to obtain a medical diagnosis or care if they are experiencing the symptoms of COVID-19. Fever, chills, sore throat, cough, shortness of breath. Those are the 5 most predominant symptoms of COVID-19. You have employees reporting with those symptoms, they should seek a medical diagnosis from their healthcare provider, and they should also be using this emergency paid sick leave. Number 4, the employee needs to care for the employee's family member who is subject to a quarantine or isolation order related to COVID-19 or who has been advised to self-quarantine by a healthcare provider for concerns related to COVID-19. Guidance on this part of the law that talks about who is a family member, it says immediate family member or shares the same household. The guidance even says a roommate. So if you have questions on whether this person qualifies as a family member, please call Human Resources and we can walk through that. Number 5, the employee needs to care for the child of such employee if the school or child care provider has been closed due to COVID-19 or child care provider is unavailable. And then number 6 does not apply to us at this time yet. Number 6 is that the employee is experiencing a substantially similar condition specified by the Secretary of Health and Human Services in consultation with Treasury and Labor. That has not been selected yet. What the guidance has said is maybe down the road in 2020, they will come up with conditions that may qualify under emergency paid sick leave. But at this time, there is no such condition or list of conditions that are determined to be similar and give you access to this leave. So you can kind of put 6 on the shelf for now. Next slide. The law provides full pay for those first 3 reasons we talked about. So a person will take time off and they will get full pay with the sick leave. For numbers 4, 5, and 6, and again, we said 6 doesn't really apply yet. The law provides for 2/3 of pay if you're going to take time off to care for a family member or to provide child care to your child because they're not in school or the child care provider is unavailable. That is what the law provides as determined by the legislature. Now, the next slide talks about how we're going to apply that. The way that we're going to apply this, I mentioned we create the sick leave bank, and it's going to be loaded with 2 weeks of leave for each employee, up to 80 hours. So if you have a full-time person who works 40 hours a week, they'll have 80 hours. If you have a full-time person who works 37.5, they're going to get 75 hours. For our fire department, who's scheduled 42 hours per week, they don't get more than 80. For those who are part-time, they will get whatever the 2-week equivalent is. But if hours fluctuate, we have employees who may work more or less. You look at a 6-month look-back period to determine their average weekly hours. Katie Graff did that for us already. We have a spreadsheet that determined what the hours will be loaded, but just as an example, if a permanent part-time employee is scheduled to work 24 hours, but in the past 6 months, actually 676 hours. So they picked up hours throughout the period. You would divide the 676 hours they worked by the 26 weeks in that pay period, and it comes out to the number 26. Then you multiply 26 by, so that permanent part-time is awarded 52 hours. Not what you would think would be the 48 hours, which is 24 times 2. So we're actually looking at that 6-month look-back period. If an employee has less than 6 months of work, don't use this method. The guidance allows us to use their scheduled or cycle hours. So if there's not 6 months of history, we're using their cycle hours times 2. For reasons 1 through 3 of those sick codes that we went through on the previous slide, our timekeepers are going to be entering the scheduled hours for the day using the EPSL pay code for the type of employee. So it's EPSL full-time, EPSL permanent part-time, EPSL part-time, or EPSL temporary. And that will deduct hours from their bank and it will pay them. For reasons 4 through 6, so you're out caring for a family member, you're out caring for your child who is not able to go to school or their child care provider. The law provides for 2/3 of pay, so we're entering 2/3 of the scheduled hours for the day. But the city is going to pay the other 1/3 using a pay code of a supplement. It's called COVID Emergency Sick Leave Supplement for the other 1/3 of the hours. So the intent is that for these 2 weeks, the employee does not suffer a reduction in earnings. The intent is that they receive their normal hourly rate for the time they take during this 2 weeks. And Again, the timekeepers have been briefed on this. I've been fielding a lot of calls this morning as they process payroll to help support them get through that. An example here would be a part-time employee who's scheduled for 6 hours. They can't work because their child is not in school, let's say. So the 6 hours is multiplied by 2/3. 4 hours is entered using EPSL part-time. That leaves 2 hours that is not scheduled to be paid under the law, but we are going to pay using that EPSL supplement. So I'm going to pause now to see if there are any questions that have been submitted through the chat and to see if there are any questions that people have. Somebody asked that I repeat what the 5 symptoms are again. Right now, the CDC has said cough, fever, shortness of breath are the 3 primaries, but they're also screening for sore throat and chills. So those are the 5 right now that are being screened for. Does anyone else have any other questions? It looked like Rose was trying to talk. I can't tell for sure.
Yeah, we can probably get
Anybody? You can always type into the chat as well if you have a question and you don't feel comfortable unmuting your phone because you might never get it muted again. Okay, I don't see any questions, so I'm gonna go forward. Someone was just laughing at my hysterical joke. That means that you're not muted, whoever was laughing. So just so you know. All right, so here's a list of the pay codes. The first one is this emergency family medical leave. We haven't gotten to that yet, but you can see under the description, they're all bunched together with COVID-19 starting them off. Then you have your EPSL full-time, EPSL permanent part-time, EPSL part-time, EPSL temporary, and then lastly, the supplement. We in HR and payroll are going to handle the accrual process and getting that posted. So this last code on the page, the ESL, rather the first one, actually neither of those. It's not on here, but there is a code to add the hours and you don't need to worry about that code. I changed this as we've been going. But these are the new pay codes. Some other notes. The hours code both pays the employee and deducts hours from the bank. That is a change from how police and fire process payroll. So we're discussing that offline with them. The supplement is very similar to how we pay short-term disability. So the timekeepers have some familiarity with that already, as does Don in payroll. We want to ensure employees are being paid their full base wage. I mentioned fire. That means they'll blow through this time quicker because it's 80 hours. And once this time is exhausted, employees have to go back to using their sick or their annual in order to be paid for time where they're not working. And we'll talk about that a little bit. There are maximums on the pay. There's caps within the law. Reasons 1 through 3, the cap in the law is $500.11 per day. For reasons 4 through 6, the cap is $200 per day. And we are still going to pay beyond that cap to the extent it's necessary so that it receives their normal hourly rate of pay. Did I hear a question? Okay. At the end of the year, if there is time left in the sick bank, it is not carried over into 2021. That's calendar year, not fiscal year. Nor is that time paid out upon termination, whether it's an employee-directed termination or employer-directed termination or a retirement. So the sick leave is not a cash-out bonus. The employees also still must use the department notification procedure for being out of work in that they need to inform you if they're not going to be at work as they do today, whether that's through a text message, a phone call, however you have set that up in your departments. There is a leave slip we have created for use for this and the expanded FMLA leave. There are some privacy reasons that might come up as a result of using this leave. And in those situations, employees can come directly to HR, just like they may for some other FMLA reasons. And then we communicate with the supervisor as well as the timekeeper to ensure that the pay is kept up to date. And then the employee may also qualify for short-term disability as a result of being diagnosed, workers' compensation if it is in fact a work-related exposure, and they may also have access to the ADA and with that disability accommodation. So in those instances, you still need to work with my department so that we can go through that. And later on, I have a slide that helps you as a takeaway try to determine the situation and what might apply. So it's a matrix you can use. We're going to move on to the expanded FMLA. Our abbreviation is EFM for that. This is an expansion of FMLA, but it only adds one new reason to use this particular expansion, and that is to care for the child under 18 years of age, unless they're disabled, then they can be older. If the child's school or place of care has been closed due to COVID-19, or the child care provider is unavailable due to COVID-19 reasons. A child care provider is defined as one who provides child care services on a regular basis and receives compensation for those services. Also, if both of the parents work for the City of Concord, only one of the parents would be eligible to take this leave, as the intention of the leave is so that the child has a caretaker, and only one caretaker is necessary according to the leave. So two differences from traditional family medical leave. One, the employee need only have 30 days of service when the leave is taken. Traditional FMLA requires 12 months of service. Also, traditional FMLA requires 1,250 hours to have been worked in that 12 months. There is no hours requirement to have been worked, just that they have been on the payroll for 30 days or longer when they take this leave. The other huge difference from FMLA is that this one actually provides some pay, where all other types of FMLA are unpaid. They have been paired with either short-term disability or sick leave, but FMLA in itself has never been a paid leave until April 1st of this year. FMLA is only going to be paid when it is related to this one reason, which is caring for children. If their school is closed, which we know in New Hampshire has been, or their child care provider is unavailable. There are some child care providers that are still open under the governor's executive order. They have loosened some of those guidelines so that first responders, for instance, and healthcare providers can still go to work knowing that there is a child care provider out there. So there are some that are still open, but not everyone's. Okay, next up, how the city will pay for this expanded family medical leave. Under the law, the first 10 days are unpaid. And you could think of that as the first 2 weeks because that is what the law intended, even though it says 10 days. The guidance has since elaborated that it intends to be the first 2 weeks. But under the emergency paid sick leave, there is a reason that allows for taking that for the same child care issue. So the first 2 weeks can be paid using the emergency paid sick leave. They also can be paid using sick leave, that is the employee's own allotment, or annual leave, although I don't know why somebody would want to use it in that capacity. Or they can be taken unpaid. One hallmark of this law is that this is an employee-driven law in the sense that they get to determine which leave they're going to use, if any. We cannot force them to use a particular leave when they take leave related to COVID-19. Also, with this expanded family medical, the total entitlement is 12 weeks. that under expanded family medical is also the same amount that is available under traditional family medical. It is not an additional 12 weeks. It is a total. So for instance, if you had an employee who had a baby in October and they utilized 10 weeks of FML, they only have 2 weeks available to use it for this childcare reason, because our FMLA runs on a rolling look back calendar of 12 months. And so that individual in my example would not have their FMLA reset until October, until the anniversary of the use. So they have the balance of the 12 weeks, which if they've used 10 is 2 weeks. After the first 2 weeks of the expanded family medical under the law, the employees are paid at 2/3. So the first 2 weeks are non-pay unless they supplement in with one of the other leaves I talked about. After the first 2 weeks, the law does provide for pay at 2/3. So our timekeepers will be entering 2/3 as COVID FMLA. And then that pay code will also provide the dollars to them. And then the other 1/3 after the 2 weeks is going to be used employee decision, either with annual leave, and they can go into a negative, or as non-pay by choice of the employee. This is only for the expanded family medical. An example of this would be a 37.5-hour person missing 3 days of leave due to childcare. So that's 7.5 hours per day times 3. That gets you to 22.5 hours. And then to get to 2/3 pay, you multiply it by 2/3 or 0.6666. And that gives you 15 hours of expanded family medical that gets entered using that COVID-19 FMLA code. The other 7.5 that we're not paying, they can choose to use annual leave or they can choose to use non-pay. If an employee chooses to not use that emergency paid sick leave during the first 2 weeks and takes it as unpaid, they still will have that 2 weeks of emergency paid sick leave in the future. So there could be a circumstance where somebody wants to hold on to the sick leave in case they get infected later, or in other circumstances where they might see a need for it. Here is the COVID-19 EFL EFM 2/3 pay code. Intermittent leave has been around FMLA since that started. This is no exception. One exception, though, is only the supervisor can allow intermittent leave. It's not required. So you get to agree to intermittent leave use for the expanded family medical and the emergency paid sick leave. There are some distinctions, though, in the law. If you have remote workers and they're unable to do the remote work due to one of the qualifying reasons of emergency paid sick leave, they can use it on an intermittent basis. So as they're able to work, they can use sick leave to supplement their hours. If they're able to work for 4 hours at a time and they need the other 4 hours off, they can use the emergency paid sick leave. So this is somebody who may be sick with COVID-19 but has a mild case. Maybe an example on the news is Chris Cuomo. He's a CNN broadcaster. He's got a mild case of COVID-19. He is doing remote work. He may not be able to do 40 hours, so he can access the emergency paid sick leave for the portion that he's not able to work. That's one example. But for on-site workers, if you are sick or you're caring for someone who is sick, you are not eligible to use it intermittently, because the whole point is to keep you out of the workplace, to keep you out from infecting others. So if you are caring for someone who is sick or you yourself are sick and you're an on-site worker right now, you cannot take it intermittently. You can use the employee family medical intermittently for both on-site and remote work. So that one is because you are caring for your child because of a child care issue, not because of a sickness issue. In that case, if you're splitting it up between you and your partner to care for the child who has a child care absence or a school absence, you can use it intermittently if the supervisor approves of it. So that's a confusing slide. You want to mark that for later because there's a lot going on there. You can use the intermittent time in 15-minute increments. That's as small as we'll go. You can use it for full days, though. For instance, you could set up a Monday, Wednesday, Friday schedule where you're going to work, and then on Tuesday, Thursday, you have to care for the child. And then you can use this EFM. So that's one example where you could see it working. And the Department of Labor has asked employers to really look at being flexible during this unprecedented type of situation where schools across the country have been closed down. I'm going to pause there, go back to that slide, and then open it up for any questions anyone may have. Okay.
Jen, this is Jamie.
Hi, Jamie.
Hey, just to throw a wrench into things, if I wanted to donate my emergency sick leave, can I?
That's a good question. I have had one other request about somebody wanting to donate annual leave to create a bank for people who might need it, and to create this EPSL. I can tell you, we can't take a donation on the emergency paid sick leave because we're under a federal mandate to provide it to the employee. We are looking at, though, can we create an annual leave bank to allow people to access if they're not able to get their paychecks? And I don't have any more information on that right now. A second piece to your question just spurred my thought, though. For exempt people that are not paid by the hour, the emergency paid sick leave is irrelevant because you have continuation in those first 2 weeks that you're out. So that will not be loaded to you. But this expanded family medical is something that would be tracked because you might need to be out of work for time for childcare as an exempt person. You would be eligible for it, and you would be tracked on that 12-week cycle. The first 2 weeks being paid, the next 10 weeks being paid at 2/3, and you could supplement the other with annual. So that is also applying to exempt personnel. So I added something to Jamie's question, but Jamie, did I answer your question?
Yes, that makes sense. Thank you.
No problem. Any other questions? Okay, I'm going to go to the next slide. Regular rate, something probably more relevant to the timekeepers, but I just want to put it out there in case any questions come out. The law requires that both of these leaves be paid at an employee's regular rate. And a regular rate is not your hourly rate. Regular rate, for the purposes of the Fair Labor Standard Act, looks at other non-overtime earnings that an employee may earn or receive, with some exceptions, and then it divides that number, the earnings, by the number of hours worked to get the regular rate. The exceptions are things like any paid annual leave, paid sick leave, any reimbursements like for a wireless device, any discretionary bonuses that are paid, like a top step bonus. Those are excluded from the earnings. But things like your acting differential would be included. So I gave a real simple example. If my hourly rate is $10 an hour and I work 40 hours a week, but I'm getting 50 cents an hour for an acting differential, my earnings for that week are $420. So then I divide 420 by the hours I worked of 40, and that comes out to my regular rate being $10.50 an hour. So even though my hourly rate is $10 an hour, this law would have me paying $10.50 an hour for people taking emergency paid sick leave or family leave. But we don't have to worry about that. That's the second bullet point, because we're already paying beyond what the law requires. Where the law looks at a 6-month look back, we did a 6-month look back thanks to Katie's work with business analytics. And when you exclude all the annual leave, the regular rate ended up being less than the hourly rate, and we're paying the full amount, not 2/3 on a lot of the leave. So using the hourly rate ends up being more favorable than using the regular rate. That again is a lot of information, mostly geared towards timekeepers. In case you get a question on what is regular rate and why aren't we using it, that would be your answer. The next slide talks about some other pieces, documentation being one thing that's come up. I already mentioned the quarantine is eligible in New Hampshire. Employers can utilize emergency paid sick leave if they haven't been exempted, but we have been exempted from the stay-at-home order. If we do quarantine a person, employees still have access to that first reason under emergency paid sick leave. So an example would be you have a spouse who's been in contact with someone who's potentially positive for COVID-19. Perhaps they work in a healthcare setting. They're waiting for that person's test results. So we as employers, you as the supervisor, ask that employee to quarantine until either those test results come back as negative, if they come back as positive, for 14 days, and coming back to work without symptoms. So 14 days is the minimum, but also they cannot come back with any symptoms. This law is in effect until the end of the year. You as the supervisor may request documentation, and that is part of the leave slip. So we're going to go to that next. We are not requiring documentation, but we do allow you the authority as a supervisor to ask for documentation. The leave slip is what we want you to use if they're taking emergency paid sick leave or expanded family medical, because we do need to track it. There is a lot of information requested on there, so to the extent that you're getting questions, you can direct them to HR. If there's any HIPAA concerns, privacy concerns, you can direct them to HR. And we still have an outstanding issue. I've had a lot of questions around it. What will be done with negative sick leave balances that have been incurred? I'm meeting weekly with the city manager to determine that. At this point, we have not made a decision about when we're going to stop letting people use negative sick leave, what we're going to restore people to if we are. I don't have any answers to that yet, but don't think it's forgotten. This is the scenario matrix I was talking about. So it has different scenarios on the left-hand side that you might run into, and then across the horizontal axis, you have, would short-term disability be something you'd look into? Would traditional family medical leave be something you'd look into? Would emergency paid sick leave be something you'd look into? Would expanded FMLA be something you'd look into? So you could look at any one in particular and then determine how it would apply, but we'll go with the second one down. Employee is mildly ill with COVID-19. So you're talking about an employee who has a positive test for COVID-19. If the doctor, would they be eligible for short-term disability? Yes, if the doctor provides documentation to UNAM that provides as such, and they're out longer than 2 weeks, which is the waiting period for short-term disability benefits. Would they be eligible for family medical traditional? Yes, if the doctor has kept them out of work for longer than 3 days, which is when family medical kicks in. Would they be eligible for that expanded FMLA? The answer is no, because the expanded FMLA is only if the absence is related to the school or child care provider being unavailable. And would they be eligible for the emergency paid sick leave? And the answer is yes, up to 80 hours prorated for part-time employees based on their illness. I did see a question come in. How about the negative annual leave for school-aged children? How can they use it, and will it have to be repaid? So the annual leave that can be incurred negatively is only for the expanded FMLA. It's only for weeks 3 through 12, and it's only if the employee chooses to do so. The annual leave will need to be repaid or re-earned if they're currently employed. If they are terminated, they will repay it at the amount that it was paid out. So in the event that they've had a pay increase since it was paid out, they don't have to repay it at their current rate of pay, but at the rate of pay that it was utilized. So the question of repayment, they do have to repay the negative annual leave if they're leaving the organization. If they're staying with the organization, they have to reaccrue it. And how long can they use it? And will it have to be repaid? I think I've answered that. They can use it for the duration of the expanded family medical leave of 12 weeks, and it does need to be repaid. So we're going to go to the new leave slip, and then I have some FAQs that I put together that people have asked. So I'm trying to capture them all in one place. The timekeeper has asked if the leave slips will be sent to the supervisors with an explanation. I said yes. That's why you got an email. The leave slips are also available on the intranet under policies, along with the 2 policies that I wrote around this. They were also included in the email invitation. So if you look in your email invitation, you should have policies attached as well as the leave slip. How will negative balances of annual leave be paid out at separation? I think I just answered that. For those who have used their own sick leave prior to 4/1, is this retroactive? No. This goes into effect on 4/1 going forward. For those who use their own sick leave on 3/31, it still is that way. And then if a close contact of mine has left the state, should I be in quarantine? So I had some questions around that. If a family member, the governor had said in one of his press conferences that if you travel frequently out of state for work, or if you've gone on an extended trip out of state, you should self-quarantine upon your return for 14 days. That is not in this law. That is a governor statement that was made during a press conference. It's not in any executive order or emergency order of his. I think a good practice would be to follow this. I'm not thinking if you have a medical appointment or you go see a counselor that's in Lowell and you're there for an hour and then you come back. I don't think that was the intent of his statement during the press conference. It is not policy. I think you want to use your best judgment there. We did that when this first started. We had people returning from trips. We had people returning from cruises. And we tried to use our best judgment, but this has been a dynamic situation that's been changing. So we can evaluate that as we get questions, but that is what the governor had stated was his recommendation. I feel like I had another thing to add here as far as a question I got. Let me just look back. Oh, yeah, it was about the furloughed employees. We furloughed employees as of 3/28. I think I mentioned that during this presentation. They are not eligible for a retroactive payment of the sick leave. They would be eligible once they are returned to service, if they are returned to service, and for any new temps that we bring on board. So that's it for the PowerPoint, but I do want to share with you the sick leave. What that slip looks like. Everyone see? You could just put it in chat or somebody unmute themselves to tell me if you can see the leave request form.
We can see it.
Awesome.
Yep.
I had a new question come in while I was getting that pulled up. Can I send this PowerPoint out? Yes, I can. I'll send it out to everyone who emails me that they attended. Then that is one of my requirements. You email me to let you know that you attended because I can't really tell who's calling in. And then another question, if we furlough permanent part-time employees, are they eligible for unemployment? Anybody who is eligible for unemployment. There is guidance out there from the state that says they would be eligible. The state pays their minimum of up to $427. That's based on their earnings in 5 previous quarters. The state determines that, not us. And then under the CARES Act, which is a federal law, they have expanded that to add an additional $600 to unemployment to help supplement pay. How that's going to work is an employment decision, not an employer decision. We don't make determinations. We don't set the level of the benefit. So our only obligation is to accurately report the status of the employee, and HR is handling that. We have all the requests for that. We've already completed 24 requests. So here is the form. The first section is completed by the employee. You do have the authorization as a supervisor to complete it for them via phone or email. They would indicate which reason they're taking emergency paid sick leave for. And then the documentation piece is section 2B. So if they're requesting due to a quarantine, if they have been advised by a healthcare provider to quarantine, or if they are caring for a child whose school or place of care has been closed, you can request the documentation, or I can tell you what documentation is going to be necessary. Then we're going to check off what documentation we get. So section 2 is for the emergency paid sick leave. Section 3 is for that expanded family medical leave. Again, expanded family medical is only due to a lack of childcare or school due to COVID-19. They're going to check off how they want those first 10 days to be either unpaid or using the emergency paid sick leave. And then after the first 10 days are up, or 2 weeks, how do you want to continue being paid is the next section. You'll take it as unpaid, or you'll take it using annual. And then signature or email authorization. And then you have to send it to myself in HR or the timekeeper. And then they'll get it to us so that we can track this appropriately. We can indicate how the benefits will be taken care of if they're going to be off payroll for any reason. That may occur if they choose unpaid leave for any portion of these absences. I did see another question come in. If a part-timer is self-quarantining out of caution, not medically directed, will they be eligible for emergency paid sick leave? And the answer is no. Unless they have a medical provider who tells them they need to quarantine. We have a lot of people who've decided to do this either because they have a condition, they're over 60, or they have anxiety around this particular topic, which I'm not saying is not a valid reason to be quarantining. I'm just saying it doesn't provide you access to this emergency paid sick leave. So if a person is self-quarantining out of caution in the absence of a medical care provider's documentation, they are not eligible for emergency paid sick leave. This concludes what I had prepared for the presentation today. I think we're all a little confused about it. That's why I'm recording the session so we can look back on them and see what I said. I will open it up for any questions, but we only have a few minutes before we have to get off this line because it's scheduled for 2 o'clock. Just a reminder, please email me that you attended. I will send out the PowerPoint for your reference. I continue to add to the FAQs in it. And I'm going to give you one more opportunity to ask any questions.
Hey, Jen, it's Jim Major.
Yeah.
If somebody decides to do the self-quarantine without a doctor's note, can they also go into the negative leave balance?
For sick leave, at this point, they can. But I am talking to the manager about when we want to cut that off, absent documentation, because I think that is a area where we're going to see some excessive use.
Okay, so at this point, they can go negative, but
At this
that's
point, those self-quarantining can go negative, but it is an open item to discuss.
got it. Thank you.
Any other questions? I appreciate everybody's time. I appreciate you making time, because I know everybody is very busy right now. It was nice to see everybody. And we'll be in touch soon. Thank you.